So let's talk some pleomorphic bacteria, gram-negative bacteria, and these are pretty much high yield topics. We're going to discuss Mycoplasma and Legionella. So regarding Mycoplasma, it is very much atypical Mycoplasma. In the atypical gram-negative or pleomorphic variety we have Mycoplasma, and in this Mycoplasma, myco mean fungi and plasma is related to plasma membrane or cell membrane. So the word mycoplasma is derived from the cell membrane structure in which there is a fungi like sterols in the plasma membrane. So it's a kind of bacteria which is having sterols in its plasma membrane. That's why it is not visualized on gram staining. So we have to prepare eaten agar which need this sterol or which grow on this sterol, and eaten agar has sterols, so mycoplasma grow on the eaten agar. So this is about the name, the literal meaning, and also the identification of Mycoplasma. So Mycoplasma, the specific species of Mycoplasma is pneumoniae. So Mycoplasma causing classical atypical or walking pneumonia. Atypical means it is not typical, rather beyond the typical symptoms as we have seen in pneumonia. And walking mean that the patient is having low grade fever, headache, non-specific symptoms, and it has insidious onset. So a person is what we have seen on clinical picture, that the person is relatively having a low fever, headache, and a mild flu-like symptoms. But when we do chest X-ray, we'll find atypicality of this pneumonia, that is a worst case scenario of very severe diffuse pulmonary interstitial infiltrate, and these infiltrates happen because of the mycoplasma. It binds to I antigen, and this I antigen is very much present on respiratory epithelium and RBCs. So we have a trillion cells of alveoli in the respiratory system. So mycoplasma goes to the respiratory system, binds to its binds to its epithelial I antigen, so exponentially grow in all the respiratory tree of human body, and releases complement activation and IgM cold agglutinins. These agglutinin in the respiratory epithelium destroy or diffusely infiltrate into the pulmonary interstitial cells, and in the RBCs it agglutinates and causing autoimmune hemolytic anemia. So this is how RBCs and respiratory system affected. The next we seen erythema multiform, and in this malar rash we have seen CD8 cytotoxic cytotoxic T cell mediated damage to the skin epithelium, and it causes malar rashes. So the three symptoms: malar rash, autoimmune hemolytic anemia, then we have the diffuse pulmonary interstitial infiltrate. These all are giving the clue for this mycoplasma pneumonia. So mycoplasma pneumonia has no typical glycan type of cell wall, so penicillins are ineffective. Rather, we use macrolides, doxycycline, and quinolones in order to fight with this bacteria, and it very frequently attack population which is less than 30 years old, and in children and adolescent it can cause an atypical variant of Steven-Johnson syndrome. After this we can say that the mycoplasma is very much common in 30 years of outbreak in the military recruits and in the college students, college dormitories, and also in the prisons. So this is a pretty high yield type of bacteria, very much tested, very much linked to different musculoskeletal or connective tissue disorder, also linked to anemia, blood hematological disorders, also linked to respiratory system. So this is all about mycoplasma pneumonia. Then we have the Legionella infection or the Legionella bacteria. Legionella pneumophilia or Legionella pneumoniae. The word Legionella is given from the Legion Hotel, in which there is a outbreak in the high officials. I have read this on online. You can also research about this Legionella word and Legionella pneumonia. That in that outbreak there is a very severe kind of unilateral lobar pneumonia, and at that time the officials are in the hotel, Legion Hotel. The officials are pretty much smokers, and they are also old age, like the senior, not very much old, that like 50, in their 50s or 40s and 50s and 60s. So they may having some chronic lung disease because they are smokers, so definitely their lungs are not very much competent. So pneumonia in smoker chronic lung disease, and also give hyponatremia. And in the hotel there is a air conditioning system, and this air conditioning system through aerosols, and that aerosols goes into the respiratory system of all the officials and causes a lot of death by that incident. So after that incident, this type of bacteria is discovered and named after the hotel, Legion Hotel or Legionnaires. So Legionella is poorly stained poorly stained on gram staining, so we use silver stain, and also we use charcoal agar with iron and cysteine to grow this bacteria. In order to diagnose, we use urine antigen and the clinical picture, and uh, aerosol and also and besides air conditioning system, it can also spread via hot water tanks. Hot water tanks also give a lot of steam, so aerosol is the main route of transmission. And the difference between Legionella and Mycoplasma pneumonia is the presence of this hyponatremia. Also, Legionella has some GIT problem like diarrhea and sinus problem like headache, confusion, etc. So there is a high fever along with GIT and CNS symptoms, diarrhea, headache, confusion, and on the labs we have hyponatremia, and on the X-ray we have the lobar pneumonia. So Legionella is also an intracellular evading the intercellular pathogen evading the phagolysosome, and it can also causes pontine fever, also known as mild flu-like symptoms. So how to treat Legionella? We give quinolones and macrolides, macros and quinolones. So this is all about the pleomorphic to high yield gram negative bacteria.